On to the last seminar with Dr. Veronica. This is a webinar introducing the quantitative research methods, and having with us today is Dr. Veronica Menea. And hopefully you're gonna have a great time with her today. So let's have Veronica to introduce herself.
So hi, it's Friday, and I'm super happy to have you today. My name is Veronica Minaya. I'm a senior research associate at the Community College Research Center, Teachers College at Columbia University. And today I'm going to talk a little bit about quantitative research methods. I don't want to go completely into detail because it's like I don't know your background and I don't know at this stage, how you are planning to use quantitative methods in your research. But what I would like you guys to and ladies to know and to have more information about this is like the quantitative methods give you like more options to investigate different research questions. So that's how I'm going to walk you through what kind of research questions you can approach using quantitative methods, and like the wide variety of, because it's like there are like a lot of different methods that you can use to actually approach your question, even within quantitative methods. So I don't know if you guys if you feel, I'm gonna share my screen and I'm gonna try to check the chat. But if you have any questions, so feel free to mute yourself and then mute yourself afterwards. I'd rather having a very interactive session, but I know, it's Friday. I mean, it's hard for everybody. It's the end of the week. So I totally understand. But at the same time, I think if it's the last seminar, you guys may have the opportunity to actually take advantage of like me giving you personalized advice to develop your proposal and maybe to incorporate quantitative methods in it. So I'm going to share my screen now. I think it's this one. Can you all see my screen?
Yes, we can see it.
Cool. Now, okay. So as I initially introduced this session, I would like to, I know you guys in some ways have already had these other 2 seminars in which you have discussed different research questions and how to develop your research idea or proposal. But I would like to share how I approach research from the quantitative perspective with you, and how we develop theories and how we develop hypotheses and expectations and to design our own research. Also, I'm gonna share some major methodological considerations, and I'm hoping that you guys have I'm going to share with you like some basic understanding of quantitative methods, particularly causal methods, which is what I do in my research. So I know you guys, the theme is today COVID, but I wanted to purposely try to think of something else in a way to expand the usefulness of COVID methods by looking at a topic that is more broad and is more it's more the topic of my own research. And it can also be adjusted to COVID, like if you want to do something for the sociological focus area, that's something that it might fit in. But so I wanted to start saying like quantitative methods, it's hard to define because what is the difference between qualitative and quantitative, right? Like, is it how we do it, or or it's what we do when you're doing the research. So one of the big differences is the data. So how we apply, because we can approach the same problem, we can do research about the same thing and have very similar research questions, but the question would be like, maybe instead of saying how, we're going to say do. Is this effective, instead of saying how or why, or what is effective. What we do is like we approach quantitative methods from a very causal point, causal inference perspective. Causal inference means that what we want to do using quantitative methods is to attribute causality. So cause effect. So if something happened and then something else happened because of this thing, and not because of any other thing that might be correlated with the treatment, as we call, or intervention. So today we're going to talk about like an intervention or a program or a policy that in this case is Million of Girls Moonshoot. And this is a program that is it's intended to improve girls' participation in STEM. As you know, STEM, science, technology, engineering, and math. It's a field in which like a lot of racial minorities, particularly Hispanics and Black students, are underrepresented in, and also in which like not many women actually participate in this kind of fields. And there is a problem that it starts early in high school, and then it continues as they progress, hopefully into college and afterwards in the labor market. So this program is trying to improve girls' participation, but also like, it's not only intended to only treat or like only serve girls, also boys. So it's like both female and male high schoolers can participate in this program. But what it makes it different is that it's a very targeted program. It consists in an after-school program in which you get a mentor, and the mentor is going to have a different approach that is going to transform the curriculum in a way that is going to help students to have a more entertaining experience with STEM, with science. And that hopefully is going to engage them into science, and then therefore, after they finish high school, they might be more encouraged, or like might have more interested in doing STEM once they are in college, and hopefully graduate from college and work in a STEM major, and that way improve participation of those who normally are not that encouraged to participate in these kind of fields, or they feel less confident about their capacity to perform in more like male and while-dominated fields. So this is what I want to share here is not only the program itself, right? Something that I'm sure you guys are thinking about. How do you do research? So I always find my research, I have to have an issue, a question, a motivation. What am I interested in? So if it's why we need to know more, and who's going to be my audience, and how I'm going to contribute to the literature, to policymakers, to in general, any other like the media, public opinion. So for that, it's important to have a very strong motivation. So in this case, it's like, and I'm sure when you develop your research, you also have this, but I follow this structure. So I normally have a motivation, which is like, okay, so there is a deficit of girls in STEM. So that's a big problem because, if you work in STEM, your salary is actually, on average, the returns to a STEM degree is higher than in non-STEM degrees. So if you have less women in STEM, they're going to end up making less money. And then, they're going to be a bigger wage gap between men and women. So it's actually a big problem to don't have as much participation of women as of men in these kind of fields that are so important. And particularly right now with COVID, right? Like there is, science is being like a big contributor to hopefully getting back to normal. And to do science, you need people that are like from different races and from different genders, because it's the trials, as we all know, you cluster right now by gender, you cluster by race, you cluster by age, because people have different morbidities, and that's why it's important to be sure that the vaccine in this case will be effective, and it would help different groups, population groups, right? And so for that, you need people who are different too, because if you're only interested in in males as a scientist, then you're not necessarily going to think of how we can vaccinate women, or how different it can be, or if it's good for pregnant women, or for certain attributes that are specific to certain groups. So it is important. So for me, it's this is a big motivation. So then it's the context. So for me, the context is okay, so we have this, that it could be the solution to my problem. So it's not necessarily here the solution, but I think it's a good program that can help girls to be more motivated and improve their interest in STEM. So my context is my what. So my motivation is my why. My context is what can I do, or what can can we implement or improve in order to improve the problem or the issue that I want to tackle in my motivation section. And then my research questions. And the research questions here, I have a different set of research questions, because this is the third seminar. And what I'm trying to do is you guys don't necessarily need to do only qualitative or quantitative. You can do either, you can do both. I think there's nothing like mixed methods, and it's the best is to actually combine both, so you can actually understand why. So, we can know, if you know how a program or how an intervention, in the case of the vaccine, for instance, is implemented, so you have a better understanding if it's going to be, effective, because more people are going to take it, more people are under what conditions are going to be more willing to participate in the program. Does that actually affect the effectivity of the vaccine, for instance, right? Like if we have more people that are more worry about their health, and they believe in vaccines, and they are all participating only in your study, then it might not be necessarily that the vaccine is super effective. It might be that these people who are self-selecting into participating in vaccination trials are really more careful. They stay at home, and then there's very less likely that they're gonna get the virus. Same in this case. So in this case, it's we need to know the how. We need to know does it work, and we need to identify the outcomes. So when we say does it work in this program, is it actually improving engagement? Like, are girls more engaged in STEM? Are girls persisting if they take a science high school course, if they persist and then they go and declare a major in STEM once they are in college? Learning, are they developing science skills? Is it that they're actually learning during these mentoring sessions after school? And achievement, for instance, if their GPA in science courses in high school, it's improving thanks to this program. So we always have to think, when you develop your research questions, also in what are going to be your outcomes. So what are you expecting to improve and that you can measure? And so then you look for data, right? And if it's quantitative, it can be quantitative or it can be qualitative. Why does it work is more a qualitative question, right? It's something that you can also collect through surveys, for instance. You can create your own survey, and you can ask participants of the program in a scale of 1 to 5. Do you think that the program was effective? In a scale of 1 to 5, is your interest in STEM higher? What's your interest in STEM from 1 to 5? If it's now 5, higher versus lower. So you can develop actually your own data, and you can also combine it with interviews. You can conduct interviews to participants, and you can also combine it with school information, school data, because the school has all these administrative data that we call it, and it's administrative because it's used for reporting purposes. So schools collect data for each term term in which students enroll, like what kind of courses the student take, what kind of grades they take, throughout high school. And then you can then merge that data to post-secondary administrative data. And then you can actually follow that student up to college, if they went to college, and if they went to college, what courses, what major, if they graduated, and then you can merge it also with earnings data. And so then you can track this person who was potentially a participant of the Million of Girls Moonshot program, and you can track her from high school up to the labor market. And so you can then, study the program in different phases and different outcomes and include different outcomes of interest to quantify the effectiveness of the program. And then for whom and under what conditions? So for whom is something that you can approach qualitatively and quantitatively. So when we say for whom, is like what kind of subgroups does this program has heterogeneous effects? If it's only affecting girls, if it's affecting girls more than boys, if it's affecting more Latins and Black students, if it's affecting only white students. So for that is important because it depends also in the intention of your program. If it goes beyond, improving the effectiveness of the program in the sense of improving the STEM outcomes, if you also want to know some kind of equity, you have an equity angle in your goals. So then you need to know what kind of groups this program is affecting or not, and under what conditions. So this is important, particularly if you want to scale up a program, or if you want to scale up an intervention, or if you want to scale up a timeline. So for instance, conditions have changed between 2019 and right now with the pandemic. So under what conditions certain policies are effective, right? So it's things that we have to think of when we develop a proposal. It can go, but as long as you have a clear motivation and context, your research interest can be broad and can be approached using different methods. And one is quantitative methods. So when I was sharing at the beginning is that it's important that you develop your own theoretical model. What in theory it's happening that is going to produce these outcomes, or of what is what you are going to study, right? What is the purpose of your study? And the goal is your motivation, right? So the outcome that you want to improve, in this case, the moon girls, the Million Girls Moonshot wants to improve STEM persistence and learning, right? Because the goal is to actually improve that, because this is a problem, this is low. So this is my outcome. What is the program doing? So we call it inputs. So what are the inputs of the recipe to then improve your outcomes? So the program is this part. So the program provides transformative programming, which is our curriculum-based intervention or activity that it happens after school hours, and then it provides professional development. So these two is the program, so two components, and then after they implement this, you get some outputs. We call it outputs because it's immediately, you are improving something that is going to be the mechanism through which you finally improve the outcome, which is the STEM persistence and learning. So your output is to actually have a mentor's engagement. So the mentors who are delivering the program have to be engaged, right? So for them to be engaged, this have to be something that they think or they believe it's going to be useful, and they are not wasting their time doing the professional development. And same for students, right? They have to be engaged, and if they are engaged and they participate, they attend to the sessions, then eventually we are going to be able to see the outcomes. So when we create these theoretical models, there are different pieces of the model that are going to respond to different research questions. And that's why when you develop your own theoretical model, you have to link that to your research questions from the beginning. So for instance, how was the Million of Girls Moonshot program implemented? So does the transformative programming increase girls' STEM interest in STEM? And what are the indicators of engagement and persistence? So here is only this part of your theoretical model, right? Like we are like we want to know if these components, we want to know if the transformative component is creating the outputs first, because what happens if the mechanism is not there? So maybe, they didn't, the program is great, but maybe the transformative programming wasn't well implemented. So why we would expect outcomes if the students were not attending the sessions, and the mentors who was actually delivering these sessions, they thought that it was not really useful and they didn't apply the transformative programming. So we are not going to see outcomes there, right? So it's important to understand each part of the theoretical model to be sure that you are collecting information at each point in time or at each stage of the theory of change, that you are changing the outcome. Because you want to collect information about this. Are students participating in the program? Are they coming after school? How many hours are they there? Like maybe class observations. Is it the mentors? Maybe you can have mentor satisfaction about the transformative programming. Do they think that actually the curriculum is useful? So once we have that, then we know okay, so this has been applied or implemented as intended. So we should see some outcomes. It might work, it might not work, but at least we know that it happened. Other research questions is which is what I was saying before, it's like you can just go straight to this too. So, and then you would be missing the output part, but it's still, you might not be able to collect that information. So it depends on what kind of data you have access to. So you might only have access to administrative data. That's what I mentioned. That it is administrative data is the school level data, student level data that the student collects, and that they can track, your high school transcripts and college transcripts and your grades in science courses. So you might only be able to observe this. So you might not observe if the students are participating in the program. And then that the program happened, right? So, but that's it. And you might, what you do here is there are different ways to assess if it's actually this produced this, and that's causal inference that I'm going to cover later. But you can also start by thinking some correlation, right? I don't know if you guys are familiar with these terms, but I'm going to explain it later too. But in any case, so what is important is it depends on the kind of information you have, your research questions are going to change. Here, for instance, is another example. So if I actually have information of the two components, because as we know, there are two components. So we have information that maybe 50% of the classes 50% of the time is devoted to this, and the other 50% of the time in the program is devoted to improve the professional development of the mentors. So are we supposed to expect that one is more effective than the other one to improve this? Or are we supposed to expect that these have complementaries and the two of them together are actually improving persistence and learning? Or maybe none of these two. So it's important that when you have components to also try to get information of each component of your intervention, because your research questions are going to be different, and also how much you can explain the effect would be limited by the type of information that you get from the beginning of the intervention. So professional development may be independent of this approach. These two may be totally different. And actually, maybe some schools don't have enough resources to implement both. So, and what if that this is the most effective? So then you don't necessarily need to implement both because those are independent, right? But it could be the opposite. It could be that actually you need both, otherwise there's no impact. So there's no way that doing it one or the other one. So that's why it's important to study all these things, because when you do research, you have to think of your the other end, like the one that you are trying, the outcome that you're trying to improve, and the subjects. So, and the subjects might have some resource constraints. So that's why you always have to think of like, can they do it all? Do they have enough time to do it all? Do they have enough resources to do it all? And that's why we are interested in maximizing the resource allocation in that way. And that's why we want to know specifically what is the best way to approach a problem to solve it. And that's how we do it with causal methods. This is another example, like again, your research question changed. So that this new science curriculum improve learning through teachers' practices or the mentor's practice, or actually improve learning directly and just to student practice, it's student engagement. Maybe that you don't even necessarily need the mentor's professional development. Maybe the curriculum or the transformative programming is so interesting that the students are just engaged, right? And they love and they are engaged in the STEM and they already are going to produce these outcomes. So maybe this mechanism is not as effective. So it's important to always know what are your mechanisms and your research questions. You can do that. You can elaborate your research questions depending on how you want to approach what part of the causal change you want to study. So this is another example. It can be one, as I said, it can be two together. Is it only the mentor's practice that matters? Is it actually student engagement that matters the most? Is it, are both of them that actually get affected and that's why you improve STEM outcomes? Or is just that you just need the mentor to be better and the students don't need to necessarily change their behavior for them, just be more interested in STEM? So these are research questions that you guys can elaborate depending on the problem that you want to approach. But when we do this, these logical models, it helps you think through it. All the single pieces that are involved in your research, all your subjects, and what is their role, and how can they, what kind of information you can get from them to then use it in using qualitative or quantitative methods to then infer something about the outcome of your interest. So this is kind of like another way to see it, right? Like saying, we say, is it like just that the transformative programming improves STEM through the mentor's practice only if mentors have received effective professional training. So if they haven't received professional training, maybe the mentors, like, if there's no professional training, maybe there's no impact, but maybe they actually need the professional training. So that's another way to approach the research question. So I want to talk a little bit about major considerations when we talk about quantitative methods. What is data, right? Like, what do we want to measure? What is your outcome of interest? So in my example, if the outcome of interest is improving STEM interest or STEM engagement or STEM skills, what is that? How are you going to measure that, right? So that's a big question, because when you do research, your research questions have to be realistic. And every time you develop a research question, you have to, back in your mind, think, oh, okay, I think I can respond to this. I can study this using this, because this data is available. And if no, unfortunately, you can keep it in your, in your theory of change, but you might not be able to approach a research question. So in this case, for instance, when we say professional development content, so yeah, we were interested in knowing, like, has professional development have happened, and our mentor-student relationship has improved, and is the transformative programming curriculum, is it inclusive, and is it like innovative and fun? And then, like, you have all these little pieces that we saw in the theory of change, and now we want to know, like, how we want to measure this. So that's a very important part, and this is the fun part about research, because you never know how much data is out there that you don't necessarily even need to collect. And even though it might not be your perfect measure, it might be close to what you are interested in. So the first, what I normally would say when we do quantitative, you go for the things that are available is the easiest because cost effective in terms of the study, right? Like doing interviews, you have to go to the field. Well, now we can do Zoom, but like still there's a lot of transactional costs. So you need to organize the calls. You need to have some letters of agreement with the, in this case, in high schools it would be, or I mean, whoever else you guys are working. So it's, and then you have to have some time. You need people to take notes. You need to process the interviews. So it can be high cost. Whereas like quantitative, you already have the data. So, you know, you just have to analyze it and then write the results. But for that, you need to have a very clear conceptual framework and clear theory of change so you can interpret your results, because otherwise you see, oh, this is better than before, but that doesn't say anything. Then the program improved a STEM, but like how? Like, is it the program? I mean, are we sure it's a program and it's not just because like only the smartest girls ended up attending? So it was like, it's not necessarily going to be, you know, attributed to the program. It can be just that they actually already liked it and now they're getting more of it, right? So measurement is a big thing. And there are different ways. I normally, what I would say is like, when I do STEM skills or interesting STEM, I use a lot of administrative data. And the administrative data is basically coming from high schools. So I get like science, like I can get high school grades in math, in science, in computer science, and then aggregate that into a GPA for these particular courses. And that would be, in this case, my outcome. Mentor-student relationship, for instance, I would do a survey, and I can survey both mentors and students and ask if they how often they talk or they meet or they discuss after the hours of the program. I can ask like from 1 to 5, is your relationship great or it's terrible? So we can get that from both sides and then have like an indicator for that, and that would be a quantitative variable. You can also approach this through interviews. It doesn't have to be, you know, a survey, because at least you would need, I mean, if there are 50 states and there are like, you know, thousands of schools involved, then this data in terms of quantitative data would be a lot of data points that will be interesting to analyze. But what if you are only studying this in 2 schools? And so you have, why you're going to collect a survey of like 2 mentors and maybe 20 students? It could be still interesting. But you mean like there's always, like you want to, when you use data, you want to use it to generalize, to conclude something. And sometimes it's better to have, I mean, normally it's better to have more observations in your data set. But what I would say is that you can also ask interviews, right? And you can just like derive from your interviews if they have a good relationship and ask qualitative questions about their interactions. Professional development content, you can ask that to the program manager, like ask for like new, you know, you can quantify like how many different contents have been delivered in the school, how many modules they have and have been implemented, how much money was invested in this. So to be sure that they actually have spent some money and invested, and this has happened. So what we want to know here, particularly in the professional development and the content, is that this happened, that we are studying something that we know it happened in the high schools in this case. Another methodological consideration are like your units of analysis. You know, like we have in research different units of analysis. Sometimes it's a student because you want to improve their outcomes, but what it can be also your school. Maybe you want to improve the value added of your school, or you want to improve some school districts give them grades. So you want to improve the grade of the school. So your unit of analysis is going to be the school. Sometimes you only have data about communities, but you have all the communities or all the counties in the country. So you can actually have this data easily publicly available. This is a little bit more tricky, but it can be a unit of analysis. What if you are only interested in teacher development or mentor development, and that's your actually main goal? So then you want to get data about this, and it's the same if you want to get data. If your intervention is at school level, you want to get data at school level. If your intervention is for students within schools, you want to get information about the students. And if you have like some interventions that in terms of community, then you want to get county data. The farther you get in the disaggregation, meaning to the individual level, the harder it is to get data. But above a student level or individuals, all these data at school and county level are available. And you can download this from different sources depending on your project, but you should be able to find this data easily. So another methodological consideration that I wanted to discuss today is like how we design the methodology. So I don't want to necessarily cover all this because I'm not sure how much you are exposed to this and how much you can use it. But this is important because we need to be sure that how we first elaborate the research questions and then how we conclude and present results. And this is super important because we cannot have, we cannot describe results in a causal way when you haven't really approached it controlling for all observables or unobservables or other potential things that might be causing this besides what you are studying. So when we do causal inference, is what I was saying, is like you want to attribute, in this case, the program, the girls program, the improvement in STEM outcome, you want to attribute it to the program, not to anything else. I mean, we want to control for like student selection, like we want to know that we don't want the best students to participate in the program because it can be that, this is the improvements in STEM is because these students were gonna be in STEM regardless, even in the absence of the program. So the program necessarily didn't change that. It was just the student characteristics that actually, improved their STEM outcomes, but not necessarily the program. So it's important when you do causal inference, there are two ways to approach it. And one is like, and you may have more information now with like the COVID topic about randomized controlled trials, right? There has been so many randomized controlled trials right now, like with to develop the COVID vaccine in different parts of the world. So why is it important to develop, like to do randomized controlled trials? And it's particularly because you want to be sure that there's nothing else besides the vaccine that is going to cure you. And that's why you want to take it. And it's effective and it's going to improve your outcomes and it's going to reduce hospitalizations and it's going to reduce death. And you want that to be the what that is going to cause these outcomes in reducing hospitalizations and deaths, right? So for that, we randomize, treatment and control. Treatment are those who receive the vaccine in this case, and the control are those who don't receive it or they get a placebo. So they think they are receiving it, but not really. So they don't change their behavior and they don't go crazy and, they go out and go to bars without a mask just because they think that they got the vaccine or not. So they just don't know if they got it or not. So when they do these randomized controlled trials, they don't know. Those who receive it don't know if they got it. Those who didn't receive it don't know if they get it. So they don't change their behavior. So then when you then compare their outcomes, it's actually both are comparables. And what happened is like, ideally, we would like to regress in time, right? Like if what would have happened in the absence of the vaccine. But you cannot know that because you already took the vaccine. So we don't know. So, but that's why we create a contrafactual, which is the control group that has to be super similar to you. So then the only difference between one, your hospitalization rate and the other one is just that you took the vaccine and the other one didn't. And hopefully if you took the vaccine, you didn't need to get hospitalized, whereas the one who didn't take it got it potentially and had to be hospitalized. And then that's how you measure the difference, and that's the effectiveness. But you cannot always do randomized control trials. It's like, as I said, you always have to think when you do your research, what is the most cost-effective way to approach your research question? Because collecting data is very expensive. And not only because you need to, roll out the entire study, but also you need to get compliance and you need to monitor that things are happening as intended. And those who, in this case, got the vaccine got it, and those who didn't get it didn't get it, because what if like the control group got it through other sources? So then it's contaminated, right? So you need somebody who's going to be monitoring both of them. And that's why these like pharmaceutical companies, they call you pretty much every week. They ask for what you've done, like what you've taken, and you are committed to that study, so they can really monitor that you are complying. And then after that, they collect your information, or they collect your blood samples to be sure if you develop antibodies or not, and then they compare between treatment and control. But as I said, you can always do it. So there are these quasi-experimental methods that we do it just with administrative data, or you do it, you can collect your own information, or you can do it also using publicly available information, depending on the level of aggregation of your research question. And I'm not going to cover all this, but I just wanted to share that there's no only, experiment, randomized controlled trials that you can do. There's always other quasi experiments that you can conduct to attribute causality. And the most important point about this is like why we want to learn causal methods. I'm sure like right now for you, I don't know if you guys have been exposed to this before, but it's important to know why, what is really effective. Like, is because that's how you can allocate resources more effectively to something that really can change lives in a generalized way. And that's why we want to study this. That's why we choose causal methods. But there are other methods in quantitative analysis. You can also use descriptive analysis. You can just do correlational analysis, but still it's not as clean, right? With correlations, there can be other factors that might be influencing your outcomes besides beyond the factor that for which you have access to information. So we learned this to mostly evaluate impact of programs and policies or interventions, or the vaccine, for instance. And we can do it in different areas, right? Like in the case of education, in the program that I was explaining before, is like, does this program really improve STEM and engagement? In case of labor market for COVID right now, there has been new job training programs that the Department of Labor have put in place due to COVID, so people can retrain and do something else, or improve their own skills while they are unemployed. So this has an effect on earnings. Is actually effective that you train them and then they can actually get a job and make more money. In health, if that's the Johnson & Johnson vaccine is effective. So these are the kind of questions that you can address when you use causal methods. So at this point, I'm gonna stop and double check if you guys are not lost. And if you have any questions, I want to check the chat too. Do you guys have any questions? No. Nothing? Okay. So I'm going to continue. Wait. Okay, maybe I have questions here. How can I see them? Okay. Okay, I do have questions. Why don't we go through the chat so, and then, we continue or we discuss something else? Okay. So Ziva is asking, can we use existing data that can be found online, or do we have to collect or use our own data? Yeah, that's a great question. If the data is credible and public, we can use it. Collecting our own data requires a lot of work. Yeah, that's true too. I live fairly well. Bye. Oh, she missed it. What can we do to be aware if our work is having lurking or confounding variables? Yeah, that's the causal methods, as we may not notice all of them. Do you recommend taking information data Wikipedia? Or I have questions. Yeah, Jessica just asked me all your questions. So at the end of this presentation, maybe I can just go show you. I added some sites. So for instance, you can collect here information about mental health during COVID. So you don't necessarily, have to collect your information. You should first double check if it's already available. This is CDC government data. I normally only use government data because first of all, has a large scale of data, like from different states, counties, and so I can have more observations or more points, data points. For economics, the BLS, the Bureau of Labor Statistics, they do have also a lot of data about the effects of COVID on earnings, unemployment, and UI claims or unemployment insurance claims. So you can also check that there. Here I put a political science report that there's data there about how the mail-in voting during COVID affected the election results. And then I think I also added here, I don't remember what it was, this one. I think this was, this was like information of this survey that they survey households. And in order to know how they were doing with the remote work and working online and different household family questions that you can use that there too. Are there certain questions that cannot be asked in a survey? Well, not really, but I would say you have to know how to design your question. So I normally pilot my surveys like you should do it with your friends and be sure that it's clear and that they understand, that it's easy for them. And the simpler the questions, the better. So if it's just there are different methodologies to develop questions in a survey, but you can potentially look at the survey here for psychology. It is like the structure and follow something like that to implement depending on your research questions to collect your own data. Yeah, I'm gonna put the links on the chat. And I was just gonna finish with the questions. Okay, so there are certain, just to think about when you develop a survey, right? It depends on what you wanna, yeah. Okay, yeah, give me an example. We're doing an anonymous survey on mental health, yeah. Are we allowed to ask if you have been diagnosed with a mental illness such as anxiety, depression, or that's too personal? Okay, so there's something called IRB, that is the Institutional Research Bureau. So I don't know how you guys deal with these projects, but for instance, in our case, every time that we collect data, we have to get some approval from the IRB. And I will share the link. Okay, thank you, Jasmine. You have to get approval from the IRB. And, if the person actually has anxiety or depression, and your question might affect her mental health more, then the IRB might question your study because you are creating harm in the subject. So, but it depends to what, depends if you are actually, how are you implementing your study? If it's like, if you're doing it through the university and you, in theory, you should go through an IRB. But I don't know how this is going to work out for you guys in this program. The other thing is, like, when you ask these questions in your surveys, you want the person to tell you the truth. So you want the questions to be something that doesn't necessarily go straight to the point. So I wouldn't ask necessarily, have you been diagnosed with anxiety or depression? I would actually check the questions on the first link of psychology, that they frame it very well. Mahi, Jasmine is going to post this, but it's more like, in the past 7 days, have you feel extra tired, or have you feel sad? So you have to always ask also, I like asking in terms of time. So you ask about a specific point in time, because otherwise it can be like, oh, have you been diagnosed with anxiety? And it was like maybe 10 years ago. So it might not be useful, that kind of information, for whatever you are studying. So I think, I don't know if that helped or no. Okay, thank you. Yeah. Okay, cool. Yes, look at that ones. And it's like, sometimes it's really good, to do some research, because these government organizations, they have to post their instruments. And that includes, of course, the surveys. So it's good you don't need to necessarily develop something new if it has been done already and it has been tested. And it has been proven that people respond reliably, and they don't change their responses depending on, like, whatever they might think that you are going to use the data for, or how they feel in that specific moment. So you don't want that. You want something, that it has been happening. So for 7 days, not that today you woke up sad because it was raining, right? Anyway, so Jasmine is going to post that. And I think I had another question about the co-founders. That is what Jessica. Yeah, so co-founding variables. Yeah, sorry, that's one of the links. No, where's my presentation? Okay. I'm going to go back to explain the co-founding part. So here. So the co-founding, let me see. Okay, no more questions. So when we talk about causal method, it's specifically like when you are worried about the co-founders, right? That it might be something else going on. Like in this example. So you have some control schools that didn't receive the program, right? And then you have some schools that did receive the program. And then you have some schools that, half of the students in the school didn't receive it and half of the students receive it. And then, you collect information in administrative data, and you look at if the percentage of the students that declare as STEM at college entries, that they chose as STEM. So which is, for me, my outcome of interest, that they are actually improving STEM choice. And you see that schools with the program, it's 8%. And a school without program is 12. So if you just compare these two and you say, oh, okay, so this didn't really help, right? So because it's like 4 percentage points lower than those who didn't get it. So if you don't use causal methods or a model to address these other co-founders, you might actually end up concluding this. So one way to avoid this is to don't conclude that. Don't say that this caused this, you know. You can just say, well, those who, if you only have these two, I don't think you can assess the effectiveness. So let's say if you only know the schools who got it and the schools who didn't, and then you know the STEM rates, you shouldn't be doing an impact study. What you can do a descriptive study, and you can describe the schools who got it and the schools who didn't get it, and see on average the schools who got it got an 8% of their student population declaring a major in STEM. On average, the other ones got 12. And then you can, you know, hypothesize why is this, because you collected some information about the characteristics of the schools. Okay, so schools who participated in the MGM, you know, these were like schools in more unprivileged areas, whereas those who didn't participate, they didn't want to participate because they were already doing great. So they were going to go into STEM, and that's why they're actually 12%. Whereas those who are in the program are from like lower income areas, without very good staff support. Maybe the mentors didn't even attend the sessions. Maybe the professional development was terrible in these schools. So there could be so many reasons, right? But you might not have that much information to really infer causality in this case, but at least you can describe like why you think some schools are doing better. And although you were not expecting that in theory from the control group, and you were expecting the opposite, but it can be because it's a selection problem. It's a co-founder that we are not observing, and we cannot really infer causality without much more information or much knowledge of what happened there. So this is the problem about correlation is not causation, right? Like, so these co-founders that you are not observing, and then they might be co-founding your results. So the co-founding is also called, like, it can be an omitted variable bias, or it can be a selection problem, which is what I was saying. Like, what if like only the schools who were from unprivileged areas decided to participate? Only those that decided to participate, those who didn't have any resources because they saw actually that it was a huge problem there, and they were the ones who went into this. Whereas the other schools that didn't participate and are your control group are the schools that didn't need it and they were doing fine, and they were going to actually do better regardless. So we are not comparing their apples to apples, right? So another way, you know, they are different now. They are like the thing about observables and unobservables that we call it, because it can be observable, something that you can control for. I don't know if you guys are familiar with regression analysis, but if not, you can also divide the results by subgroups. You know, you can try to see for schools that are poor, participated at no, and then schools that are rich and participated at no, assuming that was the co-founding variable. So in some ways, you are controlling for that by separating them into subgroups. So selection problem is a big problem because there's selection at all levels. Like, what if the selection problem is like, maybe all the schools are the same, but maybe some students, you know, who participate in the program are the most like the most excited about STEM, and those who didn't participate, they didn't like it, so they also self-selected there. So you would actually get an overestimation of the results if you had the opposite case. In this case, at the student level within the schools, you have students that love the STEM, and that's why they only chose to participate and attended all these post-curriculum or after-school hours. So the effect is going to be higher, but not necessarily because the program is good. It is just because these students were going to choose a STEM regardless. So there can be selection at school level, there can be selection at student level, there can be selection at mentor level, because the mentor level is an important channel of the effect. What if like the mentor is not really motivated and we cannot observe the motivation? So that's the thing about unobservables. We can check, for instance, let's say that we have the roster of attendance of the mentor. So we know the mentor is coming. So in theory, he is putting some effort to, to deliver the intervention to the students at the end. But what if the mentor is not really motivated? Like he's attending the sessions, but he's not doing anything during that time. So we only can observe that he's coming, but we are not observing what is happening in the classroom. So then we can say maybe there's no effect in the program, right? And then we compare and there's no effect, but it can be because we had the worst mentors. And then there's a self-selection there too at the mentor level. So one thing and the other one is always tricky to attribute one thing to the other one without thinking that 10,000 other things can be also changing your outcomes. So in research, as long as you have an idea of what is going on and a good understanding of what are these other co-founders, then you can control it in your regression analysis. And if you can observe that variable. But maybe sometimes you cannot observe it, like things like motivation, like effort, like passion, like, unobservable thing things that we cannot necessarily measure or we don't have data for. Those can be also changing your outcomes regardless of those that you are controlling for. So you have to be always cautious and always, you guys when you do your research, always think of how many other things can be going on and say and lay out your limitations. Like, okay, this is valid for this particular population because the results suggest that these might affect this, but these other things might be going on and affecting that. If you do the descriptors, you realize that some groups have more of this and other groups have more of this. This could be one of the reasons why these results are going in this direction. So these, this is a limitation of the study, and further research should be conducted to better study this research question, but it definitely is worth studying it, and it's something that researchers and policymakers should be looking at because it seems that there's something going on. So at least you can do that. So knowing why some individuals participate or are treated, it's important because then you know why, right? Like, are they the most motivated? Are they the worst students in the class? Are they are they the ones who have their parents who are like super excited about them and really help them with their schoolwork, and they have the time, to devote to their kids? So those are things that, it can change the pool of people who are treated, and the effect might actually be attributed to those things, not necessarily to the program, to the intervention. I don't know, Jessica, was that clear? Do you have any other question about that? Okay, cool. Cool. I don't know if you guys have like background in regression analysis, but if you are interested in learning these kind of things, you can ask Jasmine to ask me specifically what kind of resources you guys need, and I can send you some links so you guys can, explore more, have an idea. I think one of the most important things about this workshop is so you guys know that there's these things that can help you improve your research. It might not be available right now, but it will be available one day. And that's already motivating for you to do research because you know that you can always do better. And there are always so many tools and different ways to address your research questions. So I have another example here, which is about the causal effect of the job training programs. So now during COVID, which is one of the questions that you guys have in the business economics focus area, is job training programs, right? So during COVID has been a lot of state and federal organizations have been developing and implementing job training programs or also unemployment insurance programs for people who have lost their jobs and need to retrain or they need to go back to school. But of course, they don't have resources, it's not free. So what kind of job training programs for workforce development can be done when you have this kind of negative economic shocks. So again, we need a counterfactual, and that's what I was trying to also explain before is like, are we combining the tools? Not really, because I didn't know exactly, but now that I see you guys, I tried to do that towards the end of the presentation. So I think just me want to post on my link. So these are the, I would say, some of the tools. I was supposed to only cover quantitative method, which is like just the methods that are out there. But I know that, I mean, it would have been a data session would have been maybe more useful for you guys. I'm not gonna cover the tools, but what do you mean by tools? You mean the softwares, or you mean the actual data sets? So there are softwares. There are different ways to analyze the data. Oh, yeah. Okay, no, we're not covering the software because that's like not a 2-hour workshop, unless that you guys have all of you have background in like quantitative methods or statistics or regression analysis. But I can also send you some basics, training modules. I don't know what's your software. So this is another thing. Economists use a lot of this data on R, and other fields might use other softwares. I think like right now, more people are using R. So in different fields, I'm not sure how it's, other sectors, how they do it. There are people who only use Excel. I don't think Excel is not, that's not much. It's not an option if you want to do a really good quantitative analysis. But you can also do some very basic descriptive tables, and that can be quantitative too if you have a story to tell. If you just want to show averages of something, and that can inspire other research, that's also quantitative analysis because you are estimating averages and medians, or like confidence intervals or basic statistics to show compare different groups too. But in this session, we're not going to cover the workshops, because the softwares, because that's like at least three workshops like this, depending on your previous background and on your interest too, because I use a lot of its data, and I can show you how it looks like if we have time after this. But other people use R. R is quite fun right now with machine learning. You can do a lot of like different things with big data there. You can do like a lot of social network analysis too. I don't know if you guys are interested in that too, but so there are different softwares and different ways to approach it, but I'm just covering the big picture of what are the options to use quantitative methods in your research. Okay. Yeah, look at it up. Like look R. I'm gonna put it here. This data is not an open source, okay? But I use this data, so I'm gonna put it here. But open source. You can use R software. I don't know if you heard about it. It's open source. You can download it, and there is a GitHub where you can go in there and you can learn by yourself, and you can download code. They have code. You just tap GitHub, and you can sort it by software, and you can then search depending on your research questions. You can do, for instance, I don't know, depression. You put it there, and maybe people who have been doing research about depression using, the software R, and then they share their codes. And then you can use that code, and you can adapt it to your own data, and then replicate the same analysis. And it's a good way to learn. Okay, just to finish this, that is, I think like we are kind of, I don't know, like if you guys have any questions about what is selection process and what is the difference between correlation and causation, but I hope you guys understand that this is important differences. And even though you not necessarily can address causality all the time, and you shouldn't obsess over causality, you should be aware that in your results, some things are not causality and some things are just correlational. And as long as you are aware of your limitations, you're fine. Oh, I was talking about the counterfactual, right? I think like it's kind of covered too. So what is the counterfactual is like, what would have happened in the absence of the program? Like what I was saying is like the counterfactual is the things that is not possible, like to go back in time because you already participated in the program. So you don't know what would have happened in the absence of the program because you were part of the program. So that's the counterfactual. That's why we are trying to look something like you, somebody like you, because we cannot go back in time within the same person. We are going to find you someone similar that we can compare you to the outcomes, and that's going to be your counterfactual, and that's what is going to help us infer causality and attribute something to something after we see the outcomes of these two groups or these two persons that are similar. They are like two apples, right? And so the problem is that you never observe the counterfactual outcomes. That's what I was saying. It's impossible, as we cannot observe the person in two different states of the world, the same person. So then what, right? And this is what I was explaining to Jessica. I think in some sense I covered this. There is omitted variables and there's the selection problem into the treatment, into the intervention. And these two is like the co-founders. These are the ones that are going to be co-founding your results and might be actually changing your outcomes and not necessarily what you are studying. And students who are less interested in science might attend schools and join the program, but because of their lack of interest, they would have been less likely to choose anyways, even without the program, or the opposite. So that could be overestimating or underestimating the results of your program, and that wouldn't be accurate and it wouldn't be fair for the program because it's not really being evaluated properly. So the outcome of the same person before and after the program is what we cannot observe. And then there are many things like, that change over time too. So the pandemic, the shocks, the seasonal differences, natural process of aging, like if we cannot necessarily see how you were doing, before you enter college and after, and compare, maybe you were working before you enter college and then after you were enter college, and then you compare your outcomes and your earnings, and it's like, wow, it's like going to college is super profitable and have huge returns. But it can be other things that happen over time. It can be the opposite, right? Maybe you do worse because COVID came and then you couldn't find a job, and at least before college you had a job. So it's not necessarily there the return to your program. It's just as this happens. So you cannot just observe 2 points in time for the same person without really controlling for the individual characteristics of the same person too. So there's always these two dimensions between those who like got it, went to college, and those who didn't go to college, and also this before and after, and then you can compare these two, and we call that difference in difference, which is another quasi-experimental strategy that we use to infer causality when we cannot randomize the treatment. Okay, so what I'm saying here, causal inference requires building an argument. So yeah. So you need to also explain why. Like you cannot just say this is effective. So because even in experiments, you need to know what went wrong. So you need to still like monitor your subjects, be sure that they are not feeling that they are not doing something that they were not supposed to do, or that they are not actually taking the treatment. Like you want to know, like in the case of the vaccine, as I said, like if you got the AstraZeneca vaccine, we want to know that you didn't take that like, you also took like maybe the Pfizer that is even more effective, right? And then you find that this person is like would kind of like bias your results, because I mean, it's one person only, but like that's the idea, that would bias the results and overestimate your effectivity, because that person actually got another treatment, although she was supposed to be in this treatment. And it can be also a person of the control group that would be at the opposite kind of effect, right? So a person of the control group were not supposed to take the vaccine and then got the vaccine. So you would be underestimating the effect of the treatment of the vaccine if many people in the control group ends up doing that. So you have to, know that things went wrong. So you still have to collect information to be sure that your experiment is being conducted properly. There's compliance, that those who are assigned to the treatment are in the treatment, those who are assigned to control are in the control. And those who drop out, you can observe their characteristics, so you can then control for these characteristics in case that there's, we call it attrition, because they left the study. Observation. Yeah, those are. What else we have? So controlling for unobservables, I think like we kind of covered this, is, the things that we can observe. Like you can get individual characteristics, you can get like environment characteristics, like county characteristics, and control that in your regression analysis. And if you are sure that you're controlling for all the characteristics that affect your probability to participate in this intervention or this program, and also affect the outcome of your interest, and they are all observable, and it happened that you have all the data, then Jessica, you're good to go. You just have all your controls and all your confounders, and you control it for that. So then your coefficient of interest or your impact coefficient is controlled and weighted by that. But this is the same thing I was saying, like there's always a remaining variation, things that we cannot control that are unobservable, and we don't have data for it. So you always have to be cautious that there could be something else. Also, it can be that just because you don't know why treatment varies doesn't mean that it's randomly assigned. This can always lead to wrong conclusions. Because it can be like it's just like another characteristics that are producing these results. So what distinguishes quasi versus experimental approaches? So the experimental is random. This a lottery ticket pretty much, and you won the lottery, and then you got $10,000 and the other person lost, but it was random, right? It's not that because you were more motivated, or you were nicer, or you were smiling more, or I don't know, you were more eager to win, you got it. No, this is just, it happened. So then we can actually compare these two, because nothing else was involved in your probability of participating in this and making this and getting this 100,000 that could change your life in different outcomes. So the randomization is a big difference between these two, the quasi and experimental approaches. And these methods are different models that you are created, like you have the data and then you have to code it. You code the model, and then the software just gives you the results. And then you can conduct different robustness checks to be sure that that's what it is and it's not something else, because things can always go wrong. I think this is cover. I think this is also kind of cover, because it's in a randomized, the control trial is like the golden one, like it's the best strategy, right? Because it's random. And so there's nothing else that can be confounding in theory if it's randomized well, your results. And pretty much you assign, people to treatment, assign people to control. They receive the vaccine in this case, they didn't receive. You measure if they were hospitalized or no, hospital, same outcome if they were or no. If the treatment didn't get hospitalized, it's a 0. If it's a get hospitalized, it's a 1. You take an average of those that are in the control, those are treatment. You subtract the proportion from these two groups, and that's the average treatment effect. And that's, in this case, effectiveness of the vaccine, let's say. So these are like the other quasi-experimental methods, but I don't know if you guys have other questions. I don't know how useful it would be for you to actually look into. This is another, I mean, I can maybe just do it quickly. It's called regression discontinuity. It's based on the discontinuity because of the discontinuity is random. And what it's saying is like, what if like, for instance, to participate in dual enrollment programs, right? Like you need to have a 3.0 GPA. But if you don't have a 3.0 and you have a 2.99, you cannot participate. But you are actually very similar, but you miss it for like 0.001, like, or 0.01, that is nothing. So you can actually use that person as your control and then compare the outcomes at this discontinuity, and the difference between the outcomes in this bandwidth, that would be your coefficient of impact. Finally, so I put here some surveys and some data, and like I think it are good sources. Always, like I think it's important to always look at sources that are reliable. I normally go for government sites, and I normally get my data from the government too. You need to have, like, when you get administrative data, you need to have permission from the states, and it's a huge process, but eventually goes through. You can always request and go to that too. It just takes more time. So I would definitely like check at least the first two I checked, and there were like some information that can be useful. These two, I was just trying to, to find something that you guys might use for these other focus areas. I mostly work between these two areas, and sociology too, because education can be related to sociology. And some of these household surveys have some interesting questions that I would use for my own research. But I'm basically, my research is in education and economics. Well, thank you. And I don't know if you guys have any questions. I'm going to stop sharing.
Thank you so much. That was a very informative presentation. So let's wait for a few minutes. If anyone have any question, you guys can unmute yourself if you want to speak up, and that's easy for you. Or you can just type into the chat and we can talk about it. So for the participants here today, please fill out this attendance form that I'm sending right here. And also I attached the College Sleep YouTube channel if you want to rewatch the previous webinars. This webinar is already recorded, so it will be uploaded in tonight or tomorrow, so you can just have access to it again. So if there is no question, I think we can end the webinar today right here. Thank you so much for Dr. Veronica has spent time with us talking about quantitative research methods. It is very informative, and I saw a lot of questions for you. So I hope that helps a lot of students right here.
I hope so too, and good luck with your proposals. And I hope like you guys are all future researchers, and we can collaborate one day. Who knows? And good luck, and have a great weekend.
All right. Oh, can you put your email address into the chat, so if any students want to connect with you, they can send you an email.
Yeah. Perfect. Veronica. Oh, I put my name.
Oh, I don't have it. Oh wait.
Oh, can you see it? I know it says direct. I'm sending it to everyone. Sorry, I'm sending everything to Jessica.
All right. Thank you so much. Yeah, that's all for our webinar today. I hope you guys will have a great weekend and continue your work with your research. Thank you so much for your attendance.
Bye-bye. Thank you.